contact lens myths. Hey everyone, this is Dr. Melody Tavicoli with the Dr. Tav Consulting channel. Thanks so much for tuning in. In this video, I'm going to go over several contact lens myths. There are different types of contact lenses, but for this video, we're going to talk about soft contact lenses. This is a subject near and dear to me because it is my favorite thing to do in clinic. When someone gets contacts for the first time, they have this huge smile on their face, like this giddy, oh my gosh, I can see without glasses on my face smile. And that lights my heart up. I remember the first time I got contacts, it took me over an hour to get them in and out, but I do remember getting contacts and going to my basketball game and thinking, whoa, that's where the basket is? All right, I'm gonna make my shots now. So contact lenses do give a lot of confidence and they're really help with sports and other activities where glasses might not be ideal. One of the biggest myths with contact lenses is that you can't sleep in them. So this is a little tricky one. There are contact lenses that are FDA approved, you are allowed to sleep in. I think most optometrists agree it's better not to sleep in them. There's way more adverse reactions such as infections or ulcers when you sleep in your contact lenses. And I like to joke with patients, it's not like they're making your dreams any clearer. You don't need the vision when your eyes closed and you're asleep. So in my opinion, yes, you can technically sleep in contacts. It's better not to. Another myth about contact lenses, I've heard many patients say, oh, I have astigmatism, I can't wear contacts. And I'm very curious of who's telling them this information because there have been contact lenses that correct for astigmatism for many, many years now, at least 30 years. And they've gotten better and better. Even high amounts of astigmatism can be corrected with soft contact lenses. They might be a custom fit, a custom order, but it's totally possible to wear contact lenses if you have astigmatism. There are certain diseases where there's irregular astigmatism, the cornea is really misshapen, and there are even specialty contacts for those type of individuals. So I'm not sure who's telling you can't wear contacts if you have astigmatism. You totally can, and ask your optometrist about it next time you go in. Another myth about contact lenses is that you can use tap water or saliva to clean them. This is gross. Please do not use tap water, especially tap water or saliva to clean your contact lenses. I'm not sure where this came from. My hypothesis is hard contact lenses you can use tap water on. It's a different material. It's not the same thing going on as soft contact lenses. But please do not use water. There's all sorts of bacteria and even acanthamoeba that lives in water that can get into your contact, breed, and really damage your cornea. So tap water, absolutely no. Bottled water, no. Saliva, no. The only thing you should use with contact lenses is contact lens solution or re-wetting drops that are meant to go in with contact lenses. That being said, you might want a little travel bottle of contact lens solution. You can stick it in your car or drawer at work in case something comes up. Usually contacts go in the morning, there's no issues, and you take them out at night. Another myth about contact lenses is I'm older, I have bifocals or progressives, I can't use contacts. And this is totally not true. So if you wear bifocals or progressives, you still can wear contact lenses, even if you have astigmatism. The vision might not be as sharp as wearing glasses, but there are multifocal contact lenses, and they even come with astigmatism, so you can see far and close. Some people opt to have one eye do distance and one eye do reading, and that can work for many individuals. So there are options if you wear bifocals or progressives and you want to try contact lenses. Now, I'd say the only person that's not a good contact lens candidate is someone that has a total phobia of touching their eye. This person, it actually makes them a little nauseous, or even the thought of doing anything near their eyes freaks them out. You're not going to be a good contact lens candidate. You do have to actually touch your eye to get contacts in and out. You have to touch your eyelids, you're putting a piece of plastic in there, and you get used to it. It's not that it's that difficult, it's just something you have to learn and be trained on how to do it properly. Another myth about contact lenses is that they can get stuck behind your eye and go into your brain. That is totally not true. That has to do with the anatomy of the eyeball. You see the white part of the eye, but there's actually a clear surface on top called the conjunctiva. It totally covers, goes inside, wraps to the eyelid So there's a physical barrier. The contact lens cannot get stuck behind your eye. It can get stuck and tucked up underneath your eyelid, and there are ways to get that out, or you can see your optometrist to help you get that out. But there's no way a contact lens can actually go fully behind your eye. It is anatomically not possible. So again, fitting contact lenses is one of my favorite parts of clinic. I love getting people into contacts, and even kids can wear them. There's new contacts that help control nearsightedness, and they're FDA approved as young as 8 years old. The youngest patient I fit is probably about 8 years old, and that takes a mature 8-year-old and some parents that are willing to help and monitor. A good rule of thumb is, or at least for optometrists to ask, is how clean is your room? If a child or teenager can keep their room clean, they're probably responsible enough to keep their contacts clean. That being said, a huge trend in optometry and contact lenses is daily disposable contacts. That means you put them in the morning and you throw them away at night. There's no case, there's no solution, there's no cleaning them, there's no hassle. There's actually the least amount of adverse reactions or events when you use the daily disposable contacts. And don't worry, it's not bad for the environment. It's actually less plastic than a bottle of solution, and all the packaging is recyclable. So if you have a child, or you are a child or a teenager, or you just want to try contact lenses, I usually start with a daily disposable because, again, it's the easiest thing for you to do. It's the safest thing for you to do, and you'll see great. If you have any questions, put them in the comments below. Thanks so much for listening.